Welcome to the deep dive. Today we're tackling a really interesting topic in veterinary medicine, hypomyelination in dogs and cats.
Yeah, it's fascinating.
You've pulled together some great information, and we're going to try and unpack what this condition really means for the animals and, why it shows up in such different ways.
Exactly. So, um, hypomyelination, it's congenital. Animals are born with it. And it boils down to a problem with the myelin sheath.
Myelin. Remind us what that does again.
Right. So myelin is absolutely vital. Think of it like the insulation around an electrical wire. It's this protective coat around nerve fibers.
Okay.
And it's not just in one place. It's throughout the nervous system.
Yeah.
So the central nervous system, CNS, that's your brain and spinal cord.
Gotcha.
And also the peripheral nervous system, PNS, which is, basically all the other nerves branching out. This insulation is key for nerve signals to travel quickly and efficiently.
So if there isn't enough of it, like in hypomyelination...
If those signals get messed up, the transmission is disrupted significantly.
Okay, so that makes sense. If the wires aren't insulated properly, things go haywire. What kinds of problems does that actually cause?
Well, the nerve fibers themselves, the axons, they can end up with altered signal conduction. Or sometimes they even have, like, spontaneous electrical discharges.
Wow.
Yeah. And this is often what causes the signs we see, especially tremors. And interestingly, the severity of those tremors seems to directly link up with how much myelin is actually missing.
Right, less myelin, more shaking.
Pretty much, yeah. That's the general correlation.
And that brings us to that term you hear sometimes, shaking puppies. I assume that's mostly linked to the central nervous system form.
Exactly. Tremors are a big hallmark of the CNS form. And like we said, it's congenital, so you see these signs right from birth or just as the puppies start trying to get around.
When they start walking, it becomes obvious.
Precisely. And it's kind of amazing how it clusters in certain breeds with the CNS type.
Which ones?
Well, the list is pretty long for dogs. You've got Springer Spaniels, Samoyeds, Chow Chows, Weimaraners, Bernese mountain dogs, Dalmatians, Catahoulas, rat terriers, border terriers, even lurchers.
That is quite a few. What about cats?
In cats, Siamese seem to be the most commonly mentioned, but it's also been seen, or at least presumed, in domestic shorthairs and Burmans too.
Okay. And the overview you shared mentioned something interesting about how it's passed down genetically.
Yes, especially in Springer Spaniels and Samoyeds, it follows an X-linked recessive pattern.
X-linked. So that involves the sex chromosomes.
Exactly. What's really interesting is that the male puppies are the ones who typically show the clinical signs, the tremors.
Mm-hmm.
Females, on the other hand, are usually carriers. They might have the gene, pass it on, but they don't typically, show the shaking themselves, largely asymptomatic.
So different from other breeds where it doesn't matter if they're male or female.
Right. In many other affected breeds, there's no obvious difference between the sexes and how it presents.
Okay, so for Springers and Samoyeds, males are more likely to be clinically affected. Let's talk more about those signs. The notes mentioned action-related repetitive myoclonus. Sounds technical. What's that actually look like?
Yeah, it's a mouthful. Basically, it just means those generalized body tremors we were talking about.
The shaking.
The shaking. But the key thing is the action-related part. It tends to get worse when the animal's active, moving around, maybe excited.
And better when they rest.
Exactly.
Yeah.
It subsides or even stops completely when they rest. You might see these little pups looking like they're kind of bouncing almost because the shaking is so constant when they're up.
Bouncing, that paints a picture. Is there any good news? Does it get better?
For many breeds, yes, thankfully. The tremors often do lessen over time. They might significantly improve or even resolve completely by the time the dog's about a year old.
Oh, that's hopeful.
It is. Though some dogs might keep a little bit of a fine tremor, maybe just in the hind limbs. But, and this is important for those Springer Spaniels and Samoyeds we mentioned.
The X-linked ones.
Yes. For them, it's usually a lifelong thing. The tremors tend to persist. It's a really key difference.
Definitely noted. Any other signs besides the main tremors?
Sometimes, yeah. You might see some head bobbing or nystagmus. That's where the eyes make those rapid involuntary movements.
Okay.
Oh, and in rat terriers, there's that specific link that sometimes pops up with goiter and congenital hypothyroidism, sort of a separate but associated issue.
Interesting connection. So we see the signs, but what's actually causing this lack of myelin in the CNS? What's the root cause?
So genetics seem to be the main driver, as the overview really emphasizes. We talked about the X-linked pattern in Springers and Sammies.
Right.
In others, like rat terriers, Weimaraners, and border terriers, it looks like an autosomal recessive pattern,
Meaning?
meaning it's not linked to sex chromosomes. and an animal needs to inherit the gene from both parents to be affected. Males and females are affected equally. And for Weimaraners and rat terriers, they've actually found the specific gene mutations responsible. They even know the carrier frequency in Weimaraners is around 4.3%.
So we can test for it in those broods.
Exactly. For the others on that list, a genetic basis is still strongly suspected, but the specific genes haven't been pinned down yet.
Any other potential causes mentioned?
The overview does briefly mention that maybe, possibly viral or toxic factors could play a role in some cases, but the evidence for the genetic links is generally much stronger.
Got it. So genetics are the prime suspect. If a vet thinks a puppy has CNS hypomyelination, how do they confirm it?
Well, the first step is often what we call a presumptive diagnosis. That's based on the signalment, the breed, age, sex, plus those characteristic clinical signs and how they change over time.
Makes sense.
But for a definitive diagnosis, you really need more. That usually means looking at tissue samples under a microscope histopathology. Often, this is done after the animal has passed away during a necropsy. Or, like we just said, if you're dealing with a Weimaraner or a rat terrier, DNA testing is available to look for those known mutations. That's definitive too.
And I guess you have to rule out other things that could look similar.
Absolutely critical. Differential diagnoses are key. You got to think about things like cerebellar issues, hypoplasia, or abioatrophy. They can cause tremors too, but often you see more coordination problems, intention tremors, and they might look normal right at birth.
Okay, what else?
Storage diseases are another one, but again, newborns often seem normal initially. Then there's something called generalized tremor syndrome, but that usually hits older dogs, like over 8 months. Metabolic problems, maybe low calcium, things like that. In older cats, maybe feline polyencephalomyelitis, but that usually comes with other neurological signs. And of course, you always have to ask about toxin exposure.
Right, got to cover all the bases. So that's the CNS side. Now, you mentioned a peripheral nervous system PNS form. How does that differ? Sounds quite distinct.
It really is. First off, the timing is different. Clinical signs tend to show up later, usually around 5 to 7 weeks of age, not right at birth.
Okay, later onset.
Yeah. And in dogs, it's primarily been seen in golden retrievers, affects both males and females in that breed.
Goldens, okay. And the signs themselves, not the shaking puppy thing.
No, exactly. That's the crucial difference. The main signs with PNS hypomyelination are things like generalized weakness. It's often worse in the hind limbs.
So trouble walking.
Yeah, you see ataxia that's in coordination and paresis, which is just muscle weakness. You might also notice muscle wasting, and their reflexes might be reduced, what we call hyperreflexia.
But no tremors.
No tremors. The overview is quite clear on that tremors are not typical for the PNS form. It's more about weakness and coordination.
That is a big difference. And does this PNS form also improve with age?
Often, yes. The signs frequently do get better as the animal gets older.
Okay, so later onset, weakness, not tremors, often improves. What do we know about why this form happens? Still genetics?
It's less clear than with the CNS form in some breeds. The specific causes for PNS hypomyelination aren't really known, but a genetic link is definitely suspected, just not proven or mapped out in the same way yet.
And diagnosis must be different too, targeting those peripheral nerves.
It is. You'd start with the signs in the breed, of course. Then specialized tests come in. Electromyography, or EMG, checks muscle electrical activity. It's often normal or shows just mild changes. But nerve conduction velocity tests, measuring how fast signals travel down those peripheral nerves, that's often where you see the problem. The signals might be slow, or the response is small, or even absent.
Okay, that makes sense.
And the gold standard, really, is a nerve biopsy. Taking a tiny piece of a peripheral nerve and looking at it under the microscope, that will show the lack of sufficient myelin around the axons.
And again, I assume there are other conditions to rule out for the PNS form too.
Yep. Things like muscular dystrophy, but you usually see really high muscle enzyme levels like creatine kinase in the blood with that. Congenital myasthenia gravis is another possibility, or other kinds of nerve or muscle disorders, polyneuropathies or myopathies.
Got it. The overview also mentions some general tests that might be done for either form.
Right. Just routine stuff like blood work, CBC, biochemistry, and a urinalysis. Those are typically normal in both CNS and PNS cases. They help rule out other problems mainly.
And imaging, like MRI.
MRI can sometimes be helpful, particularly for the CNS form. It might show changes in the white matter of the brain. Those are the areas that should be rich in myelin. So abnormalities there can support the diagnosis.
Okay, so maybe some visible clues on an MRI for the brain spinal cord type. Now, the big question, I suppose, If an animal is diagnosed, what can be done? Is there treatment?
Yeah, that's the tough part. The overview is pretty straightforward here. Currently, there's no effective treatment for either the CNS or the PNS form of hypomyelination.
Nothing at all.
Nothing specific to fix the underlying myelin problem. No. Management is supportive, focusing on quality of life, but there's no cure.
Wow, that's hard news for owners. So, if treatment isn't an option, what about preventing it?
Prevention really comes down to breeding decisions, especially in those breeds where we know or strongly suspect a genetic cause.
Like the Springers, Samoyeds, Weimaraners.
Exactly. The advice is generally to avoid breeding affected animals. And where genetic tests for carriers are available, like for Weimaraners and rat terriers, using those tests can really help breeders make informed choices to reduce the risk of producing affected pups.
So, responsible breeding is key. Okay, let's talk prognosis then. What's the expected outcome?
It varies. For the CNS form, remember those Springer Spaniels and Samoyeds? They're usually affected for life.
Right, the lifelong tremors.
But for many of the other breeds with CNS hypomyelination, the outlook is often better. Those tremors frequently improve a lot, sometimes disappearing almost completely by about a year of age.
Okay, that's a big difference depending on the breed.
It is. And then for the PNS form, the golden retrievers with weakness, their prognosis is generally pretty good in terms of lifespan. They typically live a normal life, even if they might always have some lingering weakness or maybe a slightly abnormal gait.
So, quite different outcomes depending on the type and breed. Okay, let's try and wrap this up. We've covered a lot in this deep dive on hypomyelination.
We have.
We looked at this congenital issue, the lack of myelin, how vital that insulation is, and how its deficiency can hit the central nervous system, causing those shaking puppies.
Right, good tremors.
Or the peripheral nervous system, leading to that later onset weakness, but usually without the shaking.
Yeah, two very different clinical pictures from essentially the same underlying type of problem, faulty myelin.
We also touched on all those breed connections, the strong genetic links in many cases, and the unfortunate lack of a cure right now really highlights the importance of careful breeding.
Absolutely. And what strikes me is just how variable it is, how one issue, poor myelination, manifests so differently based on where in the nervous system it's happening most severely. And the genetics behind it are clearly complex.
It really drives home how intricate neurological development is. It makes you think, doesn't it, about, where the research is going. Thinking about understanding myelin better, how it forms, how it might be repaired or regenerated, what could breakthroughs there mean down the line?
Yeah, not just for this condition in animals, but potentially for human demyelinating diseases too, like MSR. There's a lot of parallel research.
Definitely gives you something to ponder, and also raises questions about the ethics around breeding when we know about these genetic risks. Lots to think about. Well, thanks for walking us through all that detail.
My pleasure. It's a complex but important area.